Okay, so I would now like to invite Annie to the stage, please. Annie Elias. Annie Elias co-founded PrimeLife Partners with Dr. Abby Bloom, an organisation dedicated to transforming how Australians live, age, care and retire. Their ADAPT data platform predicts trends for the ageing 45 plus demographic. Oh gosh, that's scary. Coming to that demographic, aiming to address housing insecurity, financial instability and care challenges through collaboration with government, industry and NGOs. Thanks so much, Annie. Welcome to the stage.
Thank you so much. Thank you. So in the background is my mum. There's two photos of her. One when she was probably in her 30s, beautiful. She tells me she was the belle of Egypt. And the older photo is towards her end of life. My mum was really lucky. She actually lived till 90. So when you look at the average age of Australians, for a woman it's 85 and for a man it's 81. So that's scary. I have an ex-father-in-law who just turned 100 this year. He's only been in a nursing home for 6 months. Why? Because as he was visiting his wife who has dementia, who's 20 years younger than him in a nursing home, he got hit by a car in the car park. A week before that, he was sending videos to my 27-year-old daughter saying, "Look at me, I'm running on Bondi Beach." This is 99. So he was really sprightly until something happened. And we know what the average lifespan is. But what's worse is that there's a difference, a big gap between our lifespan and our health span. And when I reflected on this, I thought about my mum and I thought, how lucky was she that it was literally the last 3 to 4 years of her life that were in decline in a nursing home and not very pleasant. But up until that point, she was a vibrant contributor to community. And I'm just so proud that she actually lived that long life. My ex-father-in-law was ahead of his time. He was learning Chinese when he had the accident. He's still learning Chinese. He's self-taught. He's doing that in the nursing home. Abby's mum, my co-founder, Dr. Abby Bloom, passed away last year at a tender 109. So our lifespan is long, our health span's a little shorter, about 12 years, but Abby's mum was also lucky. It was also around a few years where, you know, the care was stepped up, but Abby's mum passed away at home. She didn't have to go into a nursing home. We all have this at stake, the difference between lifespan and health span. It makes a difference to our families, to ourselves, to our communities, to our neighbourhoods, how people age well or not. There's a guy called David Sinclair who's a longevity expert globally. He lives in the United States. And he said, "In my mind, there are few sins so egregious as extending life without health. This is important. It does not matter if we can extend lifespans if we cannot extend health spans to an equal extent. And so, if we're going to do the former, we have an absolute moral obligation to do the latter." Yeah, we have that moral obligation. So, Dr. Abby Bloom and I have known each other from a very long past. I worked for Andrew Constance, who was the Minister for Ageing and Disability in 2011. I led with him the whole of government ageing strategy that still exists today, not so much in its greatest form. Because at the time we made sure that we spoke to 22 cabinet ministers and made them understand that ageing was not an ageing minister's responsibility alone. Seniors concerts don't cut it. So we looked at every single portfolio and we said, okay, so health, what are you spending on older people? Transport, parks, local councils and so on. And we came up with a really good plan, which is the fact that 90% of older people from about 2007 to today, 90% age in place. So they're our responsibility. They're living in our communities. And in fact, last week we went up to the Central Coast to do a talk for Nick. And one of the things that scared me is that the number of people aged 100 and over living in place on the Central Coast is going to treble by 2030, right? So that's actually what we're seeing. And it's good, right? It's sort of good. What a great time to be alive is my T-shirt. If we could understand people aged 45 and up, is what Abby and I started to think. If we could get a picture of people aged 45 and up, and we can look at locations, we can look at LGAs, we can look at state electorates and federal electorates, and we can map out the 45 and up across a few indicators. So we wanted to know how many of them are voters. Well, people aged 45 and up represent 52% of the voting population in Australia today. Yes, yes, that is really important because the people that vote matter. And those 45 and up, which there's a lot of people in this room, guess what? You're the real sandwich generation. We talked about the sandwich generation 20 years ago. We lied. They weren't sandwiched. No, you are the ones that are sandwiched because you still have older kids living at home because as if they can leave home, and you start to have that pinch of ageing parents. And also, you're at the peak of your career. So that happened to me. I ended up as a senior policy advisor in Canberra for 3 years when my parents were in a nursing home. And it was really tough. So I had to be creative. I drove back every weekend for 3 years so that I could be with my mum and cook her the food that she cooked for us, which was great for her vascular dementia. Anyway, we built this data tool because we thought, imagine if you can look at certain features, housing security, financial security, health conditions, assistance needed. That's what we started with. And we mapped that out against the 45 and up. So we built the tool to understand that particular demographic. Otherwise, I would have to dive into the census data and look at everyone from 0 to 100 and pull out that data myself. So we've done it in this particular platform that we've built. This is some of the data. We can do the data by local, state and federal area. This is just Ryde. I had so many choices in your area. Why did I choose Ryde? Because of the disadvantage, right? So this is the health conditions. So you've got about 40% of people aged 45 and over that have one or more chronic health conditions, right? That's startling, but obviously it's not the 45 and up that you need to worry about. It's the 55, 65, 75, 85 and up because the conditions get worse. We know, for example, that there are some key conditions that affect the 45 and up and 65 and up. 45 and up, arthritis, diabetes, heart disease, mental health. And for the 65 and up, it's arthritis, heart disease, cancer, dementia, and diabetes. We know so much through the data. But none of this matters until you see what our predictive analytics tool does when you look at the assistance that might be needed in 2030. And that's that second diagram. Each one of those people represent 100 people. So what I looked at down the track, these 45s and up and 65s and up with chronic health conditions are going to end up with 200 more women and 200 more men and 400 more women needing assistance by 2030. And that's exponentially increasing. So there's hidden problems as well. And you may think, we're health workers, we don't need to worry about people's housing security, do we? Or financial security? Well, I would argue, yes, you do. Because when I ask our generative AI, what are the key issues for this demographic in Ryde, it tells me housing costs, high cost of living, low income for some, rising healthcare costs, unemployment and underemployment. On the right-hand side are two charts. The top one is 2021 and the bottom one is 2030, the predictive analytics. And all that's telling me now is that the number of renters is increasing, the number of people that own their own homes is decreasing, the number of people with a mortgage this is all over the age of 45, is increasing. So where will people live if they're renters? When can they stop working if they're renters? And how is this all going to pan out? And why does it all matter? So when I deconstructed my mum's life, I realised that she had all of that. She was financially secure. She had a defined benefit from working in Department of Immigration in the 80s or 70s. She had housing security. She owned her own home outright, and she had a second home that she owned outright. She had health literacy. She worked in community. She was very, very concerned about her own health, but also the health of others. And mind you, at the tender age of 21, when I decided to leave home, she went into a meltdown and started Italian groups for women. Because she thought, well, I'm not the only one that their bastardry daughters have left home. So she started these Italian women's groups all over Sydney. And that's actually what kept her going. Contrast that to someone called Mei Ling, a fictional character, who is 55, she works as a cleaner 25 hours a week, she lives in Ryde, and she looks after her ageing parents and her teenage grandchildren. Well, Mei Ling doesn't have the money or time, she doesn't have health insurance, she has no money or time to actually go and see a doctor, and her health is not a priority. And this is so sad because we're seeing more and more of the data. It doesn't matter what you actually look at. You start to see that more and more people are falling through the cracks, as everyone else here has mentioned. And while my mum and my ex-father-in-law and Abby's mum had the resources, financial, health, emotional, family, they had access to healthcare, someone like Mei Ling does not. And she is really worried about going to see a doctor when her English is not that great. So what happens to Mei Ling is sick care. She doesn't get her diabetes or arthritis managed. She thinks it's just stress. Her conditions get worse. She has no access to anyone around her age that can give her good advice, and she ends up in hospital costing you guys a lot of money, all of us a lot of money. And not only that, her well-being, her getting better is going to be extended quite a lot in hospital because her health wasn't that great to begin with. But there is something called prevention is better than a cure, and we've known this forever. So there is something called the New Life Map by Stanford University, and it now maps out the 4 pillars that we've described. So it's not just your health, it's also your housing, your financial security, and it's mapping out a 100-year life. That is really scary. Then we've got Joseph Coughlin, who established the longevity economy and longevity hubs, and we've got a shit ton of devices now. And we've got a lot of data. So your area health service has data, I have data, different services have data, but at the moment we're seeing them all in silos. We're not seeing the data together in a prism. And that doesn't help anyone. So also what I realised is health people have health data, interactions of people interacting with the health system. I look at census data. The gap between shows me where the gaps are. The people that aren't being treated with diabetes, there is a massive gap there. So, rushing through, we love what your area is doing, Eugene, and we love it so much, but we thought we'd better extend it, actually, because it ain't finishing at 7 to 5 at all, and we need to now think about the 85s and the 95s. And I changed that diagram at 75 because they're my brothers. They're still having sex, one's gay, one's straight. They're having a great life. They have $2 million in their super, and they've got money to spend, but they're both still working. They have devices and they're boomers. They're not going to take any crap about their health or well-being or anything else. So all of those lines then get extended because we need that support to keep going. So what's the message in all of this? It's really quite simple. Today we have the data. I was going to say, imagine a world where you can work out right down to a postcode what's happening with people. Well, guess what? We can. We absolutely can. And we can do even better than that. We have a roadmap. We have a roadmap of the actions that we need to take. Now we need the collaborative power and the tools and the data to make a difference. So my challenge to you today, for us to be better together, you need to pick something on that map, pick a cohort, pick a demographic, pick an area, and there's 200 people here that I know are willing to work with you. Leadership. I just have to finish off by saying this. I have known Eugene for many, many years. I'm getting emotional because he's one of the best managers I've ever had. And he's not a manager, actually, he's a leader. So this is not Eugene's first rodeo about trying to pull together services across sectors, so private, public, academia, everyone together to actually improve outcomes for people. Eugene's been doing this since the UK. You've done it in mental health, you did it in fax, you did it in eye care, and now you're doing it in the PHN. So today we've heard from so many innovators doing things differently. We know what we've got to do. We actually know we've got the roadmap. We just need to learn how to do it better together. So thank you for your time. And don't forget, the data in and of itself doesn't matter. It's how we can use the data to predict how we can improve lives of people. And that includes you and me. Thank you. Did I do it in time? Ah! I was racing to the end. Thank you. Thank you.
Thanks so much, Annie. That was great. Really engaging. It's hard to find a takeaway from that, aside from the fact that, I used to think 2030 was into the future and we had plenty of time to prepare. I mean, that's 5 years, right? Like, that's the span of most strategic plans, or should be. And I think the other thing that I really took away, which I see in my personal life, is, the societal shifts. 45-year-olds are so different in their living arrangements compared to 65-year-olds compared to 85-year-olds. My children, where we go to school, there's still an assumption that everyone lives in a house in a two-parent family, and that because you're living in Lane Cove that you are able to afford all of the things, even in a public school. And certainly, those shifts around divorce, redundancy, housing are real, and they're real in Northern Sydney, and they are having a huge impact on people's lives. So how do we stay close to people? How do we stay close to the data? How do we use those stories and experiences to really harness collective action and utilise our resources for the best outcomes is really, really useful. So great to see that platform. Thank you.